1 out of 4 Americans suffers from blepharitis, and the fact that you're here is because you're probably one of them, and you're probably desperately searching for a solution. So what can you do to get rid of blepharitis? In this video, you'll get a better understanding of what is the cause of blepharitis, what is so difficult to cure it that it usually comes back. I'll reveal 2 revolutionary solutions that help my patients find a real relief. Hi, I'm Dr. Ilan Cohen, a board-certified ophthalmologist with 25 years of experience to help enhance your eyes and your vision. Before you can understand what is the right treatment for you, you have to understand the cause of blepharitis. To be able to do this, I want to explain the function of your lids and more specifically the Meibomian glands in healthy eyes. The Meibomian glands reside at the edges of your lids. They provide part of your tear film. Blepharitis causes hardening of the lipids in these glands and the blockage of the flow. That leads to dryness and inflammation in a cycle that is self-enhancing without the right solution. In other words, without the right solution, it's very hard to get rid of blepharitis. That explains why so many people struggle with it for so many years without relief. Even though you try conventional treatments, these are often ineffective to the underlying causes. Luckily, research has shown that the combination of 2 revolutionary techniques increases the success rate significantly. I'm now using these same techniques to help my patients find relief from blepharitis. The solutions I'm talking about are intense pulse light, also known as IPL, and radio frequency when used together during the same treatment. I'll explain to you in depth what these techniques do, how they work, and also analyze the support from some of the newest clinical studies. IPL therapy offers a non-invasive solution for blepharitis and dry eyes by applying pulses of light to the eyelids, targeting the Meibomian glands. It works through 4 different mechanisms. But before I continue, hit the like and subscribe button to stay updated about advances in eye care technology. Let's talk about those mechanisms. 1. The IPL reduces inflammation by targeting the abnormal blood vessels that form in blepharitis and rosacea, and they contribute to the inflammatory cycle. 2. IPL liquefies the meibom. The meibom is the fatty secretions, and the heat generated by the IPL light helps to melt and liquefy the thickened oil in the Meibomian glands, improving gland function and the quality of the oil in the tear film. The third thing, it stimulates Meibomian glands to return to their normal function, producing the necessary oils to prevent tear evaporation. And 4, the light energy also has an antibacterial effect. And this antibacterial effect reduces the inflammatory symptoms around the eyelids, as well as killing the bacteria. Another thing is that the color of light in IPL can be modified for affecting different structures of the skin residing in different depths depending on the specific condition. Added benefit of IPL therapy is that it will make your skin look younger and more vibrant because of the role of collagen production. In fact, IPL was used for the purpose of skin rejuvenation and for reducing wrinkles on the face and around the eyes. That's when the effect on dry eyes and blepharitis were discovered. You can see in this picture its actual effect on rosacea with before and after images. Rosacea is often accompanied by blood vessels and exacerbates blepharitis. This is another image showing the effect of IPL on blood vessels. In this next image, you can see how IPL could even help with removal of pigmented lesions. For dry eyes and blepharitis, 3 to 6 sessions are typically necessary. I personally find that 4 sessions produce the optimal outcomes. Now, what is radio frequency and how does that work? Like IPL, radio frequency also has been used by dermatologists for many years to improve the skin and to rejuvenate it. That led to the discovery of the benefit it has on blepharitis and dry eyes. Radio frequency treatment involves using radio waves to apply controlled heat to the Meibomian glands in the eyelids. This method aims to unblock the glands, improving oil gland function and reducing the symptoms of blepharitis. The procedure works as follows. A specialized device emits radiofrequency energy to the affected area around your eyes. This RF energy generates controlled heat. The heat effectively warms up the Meibomian glands in the eyelids and facilitates the flow of their secretions by clearing the blockage. The glands now can resume normal oil production, improving their stability and the quality of the tear film and improving blepharitis. Radiofrequency and intense pulse light treatments work synergistically for blepharitis by unclogging the Meibomian glands and reducing inflammation. RF heats and opens the glands while IPL targets inflammation and bacteria around them. Together, they offer a comprehensive solution, improving gland function and reducing eyelid inflammation more effectively. Meibomian gland expression is a manual technique for the expression of the Meibomian glands that is done in the office by the doctor right after IPL and RF treatment. Multiple clinical studies show strong support for both IPL and RF treatments for blepharitis and dry eyes. IPL and RF combination followed by Meibomian gland expression can effectively treat blepharitis and dry eyes, as well as rejuvenate and improve the appearance of the skin around the eyes. In my own office, we just upgraded to the latest RF and IPL device by iProx that combines both treatments in the same machine for the maximum benefit. This is followed by Meibomian gland expression and provides a noticeable effect even after the very first treatment, but usually 4 treatments are needed for optimal outcomes. These could be done alone or in combination with traditional blepharitis treatments for the maximum benefit. If you want to know more about traditional blepharitis treatments, please click on the video link below. To summarize, combination of IPL and radiofrequency is a very effective treatment for dry eyes and blepharitis with significant support from clinical studies. My own experience with the technology has been very positive, and I highly recommend you talk to your ophthalmologist about this. In my next video, I will show you an actual example of one of my patients being treated by IPL and radiofrequency device. If you have any questions, please put them in the comment section below, and I will do my best to answer them as soon as possible.